conference room smelled like burnt coffee and policy documents. Dr. Miriam Hale sat at the far end of the table, hands folded, wire-rimmed glasses catching the fluorescent light. Across from her, Dr. Richard Calloway straightened his tie and slid a folder toward her, without meeting her eyes. "Effective in 30 days, Dr. Hale. The board's decision is final." She didn't open it, didn't need to. The words, mandatory retirement and performance metrics, were visible through the thin paper. Her expression didn't change. 68 years old, 22 years Navy, 5 years here. This was how it ended. "I understand," she said. Calloway blinked. He'd prepared for resistance. "It's not personal. Hospital policy. Standardized performance reviews across all departments. Your surgical times have increased and—" "I said I understand. Before we begin, tell us where you're watching from, and if you want to support the channel, please subscribe and hit the like button on this video." Miriam left the conference room without another word. The hallway stretched long and white ahead of her, the kind of sterile brightness that erased shadows and history alike. She moved with the economy of someone who'd learned not to waste motion. Her steps made no sound on the linoleum. In the surgical wing, residents clustered near the board. Dr. Jenna Ortiz, chief resident, was reviewing the day's schedule with 2 interns. She glanced up as Miriam passed, then returned to her clipboard without acknowledgement. The interns didn't look up at all. Miriam entered the scrub room, empty. She washed her hands anyway, muscle memory older than some of the doctors on staff. The water ran cold, then warm. Her hands didn't shake. They never did. Not anymore. Through the observation window, an appendectomy was underway. Routine, clean. The attending's hands moved with textbook precision, but slowly. Everything here moved slowly compared to what she remembered. Compared to the field hospital outside Kandahar, where she'd once performed 14 surgeries in 6 hours, while mortars shook dust from the tent ceiling. She dried her hands, checked her pager. Nothing. In the locker room, Marcus Green was restocking supply carts. The trauma nurse looked up, caught her eye, looked away. But not before she saw the question there. He was former Army, Iraq, 2005. She'd read it in the way he moved, the way he assessed a room before entering. "You didn't lose that. Dr. Hale." "Marcus, heard Calloway called you in." "He did." Marcus said nothing for 3 seconds. Then, "Their loss." She almost smiled. Didn't, just nodded and kept walking. The resident lounge was louder. Jenna Ortiz stood near the coffee machine, talking to 2 other residents. Miriam caught fragments as she passed. 30 days, probably for the best. Response times have been— She didn't slow down, didn't react. There was no point. She'd spent 2 decades in environments where respect was earned in blood and silence, not words. This place ran on different rules. Optics, metrics, liability. Her locker was in the back corner. She opened it. Inside, 1 spare pair of scrubs, a protein bar, a photo she never looked at anymore. Naval Hospital Ship USNS Mercy, 2015, her team on deck after a 72-hour surgery marathon following a tsunami in Southeast Asia. She was in the center, exhausted, covered in someone else's blood, surrounded by people who trusted her with their lives. She closed the locker. The pager on her hip buzzed. She checked it. ER. Routine consult. Probably something the residents didn't want to handle. She clipped it back and headed downstairs. The ER was controlled chaos. Paramedics wheeling in a drunk with a head lack. A kid with a broken arm crying near Bay 3. Nurses moving between stations like choreographed dancers. Dr. Amir Bashir stood near the central desk, reviewing charts. He saw her coming and met her halfway. "Miriam, thanks for coming down. What do you have?" 54-year-old male, right lower quadrant pain, fever, elevated white count. Likely, API. CT confirmed. He's stable. But he's asking for surgery today. "I know you're—" "I'll take it." Bashir hesitated. "Jen is available if—" "I'll take it." He nodded, handed her the chart. Their eyes met for a moment. He knew. Not the details, but the shape of it. He'd lost family in Kabul. She'd lost something else, somewhere. Where else? Different wars, same scars. Bay 6, he said. She found the patient sitting upright, pale, sweating through his gown. Manual laborer, by the hands. Wedding ring. tan line from a watch. He looked up as she entered. "You the surgeon?" "I am. Dr. Hale. I'm going to take care of you." His eyes scanned her face. Old. Female. Not what he expected. She saw the doubt flicker across his expression. Saw him glance toward the door, looking for someone else. Someone younger. Someone male. She didn't wait for him to voice it. "Your appendix is inflamed. Another few hours, it ruptures. I'll have you in surgery within the hour, and you'll be home in 2 days. Any questions?" He swallowed, shook his head. "Good. Sign the consent forms. I'll see you in the OR." She left before he could reconsider. If you want to see how Dr. Hale handles what comes next, make sure you subscribe to Emergency Heroes Stories. Because what she does in the next few minutes will leave you speechless. Miriam walked toward the surgical wing, the patient's chart tucked under her arm. 30 days left. 30 days of routine consults and appendectomies and doubt in patients' eyes. She pushed through the doors. The OR smelled like iodine and cold air. She scrubbed in alone, watching the clock. 68 years old. Too old, they said. Too slow. Her hands didn't shake. Not this time. Not ever. The surgical theater was cold. Always cold. Miriam stood at the table, gloved hands waiting as the anesthesiologist finished his count. The patient was under, breathing steady through the ventilator. Across from her, a second-year resident, named Chen, shifted his weight, nervous. First time assisting her. Maybe last. "Scalpel," she said. The scrub nurse placed it in her palm without hesitation. Miriam made the incision. Clean line, right lower quadrant, McBurney's point. The blade moved with the kind of certainty that came from doing this 1,000 times in worse conditions. Chen leaned in, watching. "Retractor," she said. He fumbled it. She waited. Didn't correct him verbally. Just adjusted the angle herself, once he placed it. The peritoneum opened under her fingers. She could feel the inflammation before she saw it. Appendix was angry, dark red, not yet ruptured but close. Another hour and this would have been peritonitis, she said quietly. Chen nodded. Didn't speak. She didn't need him to. She worked in silence. Clamp. Tie. Divide. The appendix came free. She dropped it in the specimen container and checked the surrounding tissue. Clean. No contamination. She irrigated. Closed the peritoneum in layers, then the fascia. 12 minutes, start to finish. Chen stared. That was standard, she said. Close the skin, I'll watch. She stepped back, let him finish. His hands shook slightly, but the sutures were neat enough. She didn't hover. When he tied off the last stitch, she nodded. Good. Write the post-op orders. I'll check on him in recovery. She stripped her gloves and left the OR. In the hallway, 2 residents stood near the locker room door. They stopped talking when they saw her. One of them, a 3rd year named Patel, offered a polite nod. The other, a woman Miriam didn't recognize, just stared. She kept walking. The resident lounge was fuller now. Lunch hour. Jenna Ortiz sat near the window with 3 others, picking at a salad. Miriam passed through to refill her water bottle. The conversation paused. Not stopped, just paused. She heard it resume as she left. 12 minutes for an appy. She's fast, I'll give her that. Still, the board's not wrong. She's almost 70. Miriam didn't turn around. She'd heard worse. Been dismissed by better. Marcus found her in the hallway, 20 minutes later. He walked alongside her without preamble, hands in his pockets. Heard you just did an appendectomy in 12 minutes. 13, she corrected. Chen's telling anyone who'll listen it was like watching a machine. Chen needs to practice his retraction technique. Marcus almost smiled. Almost. You know they're watching you now. They've always been watching. No, I mean really watching. Calloway's got the board nervous. They're looking for reasons to justify the decision. Anything that looks like a mistake. Then I won't make one. Marcus stopped walking. She stopped too, turned to face him. His expression was careful, the kind of careful that came from knowing when to push and when to let it go. Miriam, he said, you don't have to prove anything. I'm not trying to prove anything. I'm doing my job. For 30 more days. For 30 more days. He nodded slowly, didn't argue, just walked away. She checked her pager. Another consult. Gallbladder. symptomatic, non-emergent, scheduled for tomorrow. She reviewed the chart on the tablet, made notes, signed off. Routine. Everything here was routine. Except it wasn't. Not anymore. By mid-afternoon, the whispers had shape. Miriam heard them in fragments as she moved through the hospital. Near the nurses' station, in the elevator, outside the cafeteria. 12 minutes. Didn't even break a sweat. Maybe Calloway's wrong. Or maybe she's just lucky. She ignored them, went to check on her post-op patient. He was awake, groggy, but stable. Vitals good. Pain controlled. She reviewed his chart with the recovery nurse. A woman named Stevens, who'd been there longer than most of the attendings. He's asking for you, Stevens said. Miriam stepped to the bedside. The man's eyes found hers, clearer now. Doc, he said, voice rough from the breathing tube. How do you feel? Like I got hit by a truck, but alive. He paused. They told me it was close, said you got it just in time. You'll be fine. Follow the discharge instructions. No heavy lifting for 2 weeks. Yeah, I will. He hesitated. Look, I'm sorry. Earlier. I didn't. It's fine. No, I mean it. I thought. He stopped, swallowed. Thank you. She nodded, left before he could say more. In the hallway, Dr. Bashir was reviewing a tablet near the trauma bay. He glanced up as she approached. Miriam, got a second? What do you need? He gestured to the screen. Trauma case coming in. ETA 10 minutes. MVA, single vehicle, rollover, driver stable, but there's a passenger, late 20s, possible internal bleeding. Jenna's primary. But she's stuck in a bowel resection that's running long. I need someone on standby. Miriam checked the details. Seatbelt sign across the abdomen. Hypotensive, tachycardic, likely splenic injury. I'll take it, she said. Bashir hesitated. Just a second. She saw the calculation behind his eyes. Then he nodded. Good. Trauma 2. They'll be here in 8 minutes. She headed for the trauma bay. Scrubbed in again. The room was prepped, lit hush and bright. 2 nurses, 1 resident. Marcus on standby. The resident was young, first year, name tag read Sullivan. He looked at her with something between curiosity and confusion. Dr. Hale? I'm covering for Dr. Ortiz. You're assisting. Yes, ma'am. The doors burst open. Paramedics wheeled in the gurney fast, calling out vitals as they moved. The woman on the stretcher was pale, barely conscious, seatbelt bruises dark across her chest and abdomen. 27-year-old female, restrained driver, rollover MVA, BP 90/60, heart rate 130, 2 large bore IVs placed, 1 liter normal saline in. GCS 13, complaining of abdominal pain. Miriam moved to the head of the bed, checked the airway, clear, breathing shallow but adequate. She pressed her hands gently across the abdomen, rigid, guarding, distension in the left upper quadrant. Splenic injury, she said. Get me a fast scan. Type and cross for 4 units. Call the OR. Tell them we're coming up. Marcus was already moving. The ultrasound machine rolled in. Miriam took the probe, ran it across the woman's abdomen. Fluid in Morrison's pouch. Fluid around the spleen. Free blood in the peritoneum. She's bleeding out, Sullivan said, voice tight. Not yet, Miriam said, but she will be. Let's move. They transferred her to the OR in 4 minutes. Miriam scrubbed again, faster this time. Muscle memory from years when fast meant the difference between living and dying. She entered the theater, gloved, gowned. The patient was draped. Anesthesia had her stable, but barely. Pressures dropping. The anesthesiologist said, 80/50. Hang another unit, Miriam said. Scalpel. She opened the abdomen in 1 smooth line. Blood welled up immediately. Dark, venous. She suctioned, packed, exposed the spleen. Grade 4 laceration, bleeding from the hilum. Clamp, she said. Sullivan handed it to her. She slowed the bleeding, assessed. The spleen was shattered. No saving it. We're taking it out, she said. Mobilize. Isay the spleen, carefully. Sullivan's hands shook. She guided him without touching, just voice and direction. The spleen came free. She tied off the vessels, checked for accessory spleens, irrigated the abdomen. No other injuries, just the spleen. 22 minutes, start to finish. The patient's pressure stabilized. Heart rate came down. The anesthesiologist looked at Miriam with something like disbelief. She's stable. Miriam closed in layers, didn't speak, didn't celebrate, just worked. When she stripped her gloves in the hallway, Marcus was waiting. That was a grade 4 splenic lac, he said. I know. You saved her life. I did my job. He watched her for a long moment, then nodded. Yeah, he said quietly, you did. The recovery room lights buzzed faintly overhead. The young woman from the rollover was intubated still, sedated, vitals holding steady on the monitor. Miriam stood beside the bed reviewing the post-op notes she'd just written. Her handwriting was precise, each letter formed with the same economy as her incisions. Behind her, footsteps. She didn't turn. Dr. Hale. Jenna Ortiz's voice carried an edge Miriam hadn't heard before. Not hostility exactly. Something closer to confusion. She turned. The chief resident stood 3 feet away, still in her surgical cap, arms crossed. Dr. Ortiz. I just heard about the splenectomy. Patient stable. No complications. Post-op orders are in the chart. Jenna's jaw tightened slightly. That was my case. You were unavailable. Dr. Bashir asked me to cover. A grade 4 splenic laceration isn't a cover case. That's a senior trauma surgeon case. Miriam met her eyes, calm, unflinching. Then it's good I was available. For 3 seconds, neither spoke. The monitor beeped steadily. Somewhere down the hall, a pager went off. How long was the procedure? Jenna asked. 22 minutes. Jenna blinked. From incision to close? Yes. That's not possible. It's documented. Jenna looked past her at the patient, then back. Her expression shifted, something uncertain flickering behind the professional mask. I've done 6 splenectomies. Average time is 45 minutes. Fastest was 38. Miriam said nothing. Where did you train? Jenna asked. Naval Medical Center San Diego, then field hospitals, Iraq, Afghanistan, Syria. The word Syria hung in the air. Jenna's eyes narrowed slightly, processing. Then she nodded once, turned, and walked away without another word. Miriam returned to her notes. In the surgical wing locker room, Marcus was restocking gauze when Sullivan came in, still wired from the trauma. The young resident pulled off his cap and sat heavily on the bench. I've never seen anything like that, Sullivan said. Marcus didn't look up. Like what? Dr. Hale, that splenectomy. She moved like, I don't even know how to describe it. Like she'd done it 1,000 times. Maybe she has. No, I mean. Sullivan leaned forward. There was no hesitation. Not once. She called every step before it happened. Clamp before the bleeding got worse. Suction exactly when needed. She didn't even look stressed. Marcus closed the supply cabinet, turned. She's not. What do you mean? I mean she's done worse than a splenic whack, in worse places than this OR. A lot worse. Sullivan stared. She was military? Navy. 22 years. Doing what? Marcus considered the question, then shrugged. Ask her yourself. But Sullivan didn't, and Marcus knew he wouldn't. By evening, the story had spread. Miriam heard it in the cafeteria, where she sat alone with a cup of black coffee and a sandwich she hadn't touched. 2 tables over, a group of residents talked in low voices that still carried. 22 minutes. Sullivan said she didn't even pause. Maybe Calloway's making a mistake. One of them glanced her way, looked away quickly when she didn't react. She drank her coffee. It was cold. Her pager buzzed. She checked it. ER again. Another consult. She stood, dumped the untouched sandwich, and headed downstairs. Dr. Bashir met her near the trauma bay entrance. He handed her a tablet without preamble. 61-year-old male. Came in complaining of severe epigastric pain radiating to the back. Lipase is through the roof. CT shows necrotizing pancreatitis with probable pseudocyst formation. Miriam scrolled through the imaging. The pancreas. As was a mess. Inflammation, fluid collections, early necrosis. The kind of case that could go south fast. He needs ICU monitoring, she said. Possible intervention if the pseudocyst ruptures. Who's managing him? I was hoping you would. She looked up. Bashir's expression was unreadable. This isn't a surgical case yet, she said. But it will be. And when it is, I want someone who won't hesitate. She studied him for a moment, then nodded. I'll keep him on my service. Thank you. She found the patient in Bay 4, curled on his side, pale and sweating. His wife sat beside him, holding his hand. Both looked up when Miriam entered. Mr. Carver, I'm Dr. Hale. I'll be overseeing your care. Am I dying? He asked, direct, no preamble. Not today, but you had a serious condition that needs close monitoring. We'll manage your pain, watch for complications, and intervene if necessary. Intervene means surgery. If needed, yes. His white grip tightened on his hand. Is she? She stopped herself. Is she what? Miriam asked gently. Are you the one who did that spleen surgery today? The nurses were talking about it. Miriam didn't answer immediately. Then, I'm the one who'll take care of your husband. The wife nodded, didn't ask again. Miriam admitted Carver to the ICU, wrote orders for pain management and IV fluids, and flagged his chart for hourly monitoring. She checked on the splenectomy patient again. Still stable. Then the appendectomy from that morning. Discharge planned for tomorrow. It was nearly midnight when she finally sat down in the resident lounge. The room was empty, except for one intern asleep on the couch. She poured herself water from the cooler and sat in the corner chair. Her pager hadn't stopped all day. She closed her eyes. Not sleeping, just still. The door opened. Marcus stepped in, saw her, paused. You're still here, he said. So are you. He poured his own water and sat across from her. For a minute, neither spoke. They're talking about you, he said finally. I know. Not the way they were before. She opened her eyes. It doesn't matter. Doesn't it? I have 30 days. Then I'm gone. What they think won't change that. Marcus leaned back. You know what I did in Iraq. She waited. I ran triage at a forward surgical team outside Fallujah. We'd get casualties in waves, dozens at a time. IEDs, small arms, RPGs. I got good at deciding who lived and who didn't. Got real good at it. He paused. You know what I learned? What? That the best surgeons weren't the ones who talked the most or had the best credentials. They were the ones who didn't flinch, didn't hesitate, just worked. Miriam said nothing. You don't flinch, Marcus said. That's why they're talking. I'm too old, Marcus. That's what the board says. That's what the metrics say. Metrics didn't save that girl today. You did. She looked at him. His face was open, honest, no agenda, just respect. Thank you, she said quietly. He nodded, stood. Get some sleep, Doc. You too. He left. She sat alone in the silence. Her pager buzzed again. ICU. Carver's pseudocyst was expanding, pressure rising. She stood, drained her water, and headed upstairs. The ICU was dimly lit, monitors glowing in the half-dark. The attending on call met her outside Carver's room. He's decompensating. Pressure's up, heart rate climbing. I think the cyst is leaking. Miriam checked the monitor, reviewed the latest labs, then stepped into the room. Carver was conscious, barely, eyes glazed with pain. Mr. Carver, I need to take you to surgery, now. He nodded weakly. His wife stood, face pale. Will he be okay? Miriam met her eyes. I'll do everything I can. She prepped him for emergency surgery in 8 minutes. The OR was ready. She scrubbed in fast, entered the theater. Scalpel. Incision. The pseudocyst was there, tense. Ready to rupture. She drained it carefully, irrigated, placed drains. 31 minutes. When she closed, Carver's vitals were stable. The anesthesiologist looked at her with open surprise. That was textbook, he said. That was necessary, she replied. She stripped her gloves and walked out into the pre-dawn silence. The hospital felt different now. Quieter. Watching. She didn't know it yet, but everything was about to change. The morning came gray and cold. Miriam stood at the ICU window, watching rain streak the glass. Behind her, monitors beeped in steady rhythm. Carver was sleeping, stable, wife dozing in the chair beside his bed. Another surgery, another life pulled back from the edge. Her pager buzzed. She checked it. Administrative office, Callaway. She took the stairs down 3 floors, walked the long corridor to the executive wing. The carpet here was newer, the lighting softer. A different world from the trauma bays and operating rooms. Callaway's assistant waved her through without looking up. Callaway sat behind his desk, reading something on his computer screen. He glanced up when she entered, gestured to the chair across from him. Dr. Hale, sit. She sat. He closed the laptop, folded his hands. I've been hearing things. What kind of things? 3 major procedures in 18 hours. Appendectomy, splenectomy, emergency pseudocyst drainage. All successful. All faster than average surgical times. She waited. That's impressive work, he said. It's standard work. Not according to the residents, or the nursing staff, or Dr. Bashir. He leaned back. You're making people ask questions. What questions? Whether the board made the right decision. Miriam's expression didn't change. The board made its decision based on policy. My recent cases don't change that. Calloway studied her. You're not going to argue. Would it matter? He didn't answer, just tapped his fingers once on the desk. There's a pattern in your file I've been reviewing. You don't list your full military service record, just dates and locations. No specifics about your role or rank. That's correct. Why? It wasn't relevant to my civilian position, wasn't it? He opened the laptop again, turned it toward her. On the screen, a partially redacted Navy document with her name at the top. I made some calls. Your service record is mostly classified. What I could access indicates you held senior surgical command positions in multiple combat zones. She said nothing. You were a captain, he continued. Chief Surgical Officer on the USNS Mercy. Lead trauma surgeon for Joint Special Operations Command. He paused. That's not just relevant, Dr. Hale. That's exceptional. It was a long time ago. 5 years isn't that long. It's long enough. Before he could respond, the hospital's overhead system crackled to life. A voice, calm but urgent, cut through the quiet office. Attention all personnel. Mass casualty incident, level 1 activation. ETA 12 minutes. All available surgical staff, report to trauma immediately. Repeat. Mass casualty incident, level 1. Calloway stood. What happened? Miriam was already moving toward the door. Turn on the news. She didn't wait for him. The stairwell echoed with her footsteps as she descended, fast but controlled. Her pager exploded with messages. She ignored it. The ER would be chaos in minutes. The trauma bay doors burst open as she arrived. Dr. Bashir stood at the center desk, phone pressed to his ear, coordinating with dispatch. He saw her and waved her over. What do we have? She asked. Bridge collapse. Interstate 90, main span over the shipping canal. Rush hour traffic. Estimated 40 vehicles involved. Over 100 casualties. He pulled the phone away briefly. We're getting 23 critical patients. Fire, police, and Coast Guard are still pulling people out of the water. Miriam's mind shifted, not panic, calculation. How many ORs can we staff? 4, maybe 5 if we pull people from outpatient. Do it. Get everyone in. Cancel all elective procedures. Bashir relayed the orders. Around then, the trauma bay transformed. Nurses prepped beds, respiratory therapists staged ventilators, residents pulled on gowns. The controlled chaos of preparation. Jenna Ortiz appeared at Miriam's elbow, face tight with focus. How do you want to divide teams? Miriam looked at her. No hesitation now, no doubt. Just a surgeon asking another surgeon how to save lives. You take trauma 1 and 2. Bashir takes 3. I'll float and take overflow. You sure you don't want a dedicated bay? I'm sure. You're faster with a team. I'm faster alone. Jenna nodded, didn't question it. The first ambulance arrived 9 minutes later, sirens screaming. Paramedics shouting handoff reports as they wheeled gurneys through the doors. Blood, water, the smell of diesel fuel and wet asphalt. 34-year-old male, crush injury to chest and abdomen, BP barely palpable, heart rate 160. Jenna took him, trauma 1, second ambulance. 51-year-old female, open tib-fib fracture, GCS 14, hypothermic from water immersion. Bashir, trauma 3, third ambulance, 4th, 5th. The base filled, then overfilled. Patients lined the hallways on backboards. Residents triaged on the fly, marking foreheads with colored markers. Red, yellow, green, black. Miriam moved between them, assessed a pneumothorax, placed a chest tube in 40 seconds, stabilized a flail chest, intubated a woman whose airway was closing from facial trauma. Her hands moved without thought, guided by decades of muscle memory. Marcus appeared beside her as she finished the intubation. We've got an overflow patient. Nobody else is free. Where? Trauma 4. They just brought her in. Miriam followed him. The woman on the gurney was young, mid-20s, soaked through. Lips blue from cold, but it wasn't the hypothermia that made Miriam stop. It was the steel cable fragment protruding from her chest. 3 inches of braided metal, punched clean through the left side of her sternum. The woman's eyes were half open, unfocused. The monitor showed a heart rate of 30, blood pressure 60 over nothing. The paramedic was still talking. Bridge cable snapped during the collapse, went through the windshield like a spear. She's been down twice already. We got her back both times, but she's... Get her to OR2, Miriam said. Dr. Hale, she's been in arrest for... now. Marcus didn't argue. He grabbed the gurney and pushed. Miriam ran alongside, hand on the woman's neck, feeling for a pulse. Faint, thready, barely there. They hit the OR in 90 seconds. Anesthesia took one look and shook his head. She's gone. She's been down too long. She's not gone until I say she's gone, Miriam said. Intubate her. Get me blood. Get me a thoracotomy tray. The anesthesiologist stared, then moved. Miriam scrubbed in 30 seconds. Didn't dry her hands, just gloved wet. The woman was draped. The cable fragment stood upright from her chest, slick with blood. Scalpel. She opened the chest. Rib spreaders. The cable had pierced the left ventricle, a clean puncture that was bleeding internally. The heart wasn't beating, just quivering. She's in V-fib, the anesthesiologist said. I can see that. Charge to 200. Dr. Hale. Charge. He charged. She pulled the cable free in one smooth motion, clamped the ventricle, shocked. Nothing. Shocked again. Nothing. She's flatline, the nurse said quietly. Miriam placed her hand directly on the heart, began manual compressions. 1, 2, 3. The room was silent except for the monitor's steady whine. Dr. Hale, the anesthesiologist said gently. She's been down 14 minutes. I know how long she's been down. She compressed. 15, 16, 17. Behind her the OR door opened. She didn't turn, didn't stop, but she heard the footsteps, heard Calloway's voice. What's going on? Marcus answered. Dr. Hale's trying to bring her back. How long has she been in arrest? 14 minutes. That's... Calloway stopped, watched. Miriam compressed. 20, 21. Her hand moved with mechanical precision, squeezing the heart manually, forcing blood through chambers that had given up. There's no point. Calloway said quietly. Miriam didn't answer, didn't stop. 30 compressions, 40. Dr. Hale, get out or help, she said. Not angry, not emotional, just factual. Calloway stayed. 50 compressions. And then, beneath her palm, a flutter. She froze, felt it again. A beat. Weak, but real. I have a rhythm, the anesthesiologist said, disbelief in his voice. The monitor beeped. Once, twice. A rhythm appearing on the screen, like a ghost solidifying. Miriam sutured the ventricle. Fast, precise. 3 stitches. The heart beat again, stronger. Sinus rhythm, the anesthesiologist whispered. She's back. The room exhaled collectively. Miriam closed the chest, didn't speak, just worked. When she stepped back, the woman's pressure was rising, heart rate stabilizing. Calloway stared at the monitor, then at Miriam. How did you? Subscribe to the channel to see what happens next, Marcus said quietly from the corner, a strange smile on his face. Then, more seriously, she did what needed to be done. Miriam stripped, ipped her gloves, walked out into the hallway, and for the first time in 5 years, let herself believe she still belonged here. The hallway outside OR2 was quiet in a way that felt unnatural. Behind the doors, the bridge collapse casualties still poured in, voices sharp with urgency, monitors screaming. But here, in this pocket of sterile fluorescent light, Miriam stood alone, hands braced against the wall, breathing. Not shaking, not panicking, just breathing. 14 minutes. She'd brought someone back from 14 minutes of cardiac arrest. The textbooks said it was impossible. The protocols said to call it. But the textbooks hadn't been written in a field hospital outside Kandahar, where impossible was just another Tuesday. The door behind her opened. She straightened, turned. Dr. Calloway stood in the threshold, still wearing the surgical cap he'd pulled on to observe. His face was unreadable. A careful neutrality that she recognized from her own mirror on bad days. Dr. Hale. Dr. Calloway. He stepped into the hallway, let the door close behind him. For a moment, he just looked at her. Then, I need to understand what I just saw. A cardiac resuscitation. After 14 minutes of arrest, with manual compressions directly on the heart. That's not standard protocol. Standard protocol would have let her die. His jaw tightened. Where did you learn that technique? She met his eyes. Does it matter? Yes, it matters. He moved closer, voice dropping. I pulled what I could from your service record, but most of it's redacted. I know you were Navy. I know you held command positions. What I don't know is why a surgeon with your apparent skill set spent the last 5 years taking routine cases and staying invisible. Miriam said nothing. I looked at your surgical logs from the past 5 years, Calloway continued. Appendectomies, cholecystectomies, hernias, basic general surgery. Competent, but unremarkable. Nothing that would indicate. He gestured toward the OR. That. I did what was asked of me. Why? A question hung between them. Down the hall, a code blue was called. Neither of them moved. Because I was done, Miriam said finally. With combat, with command, with making impossible decisions in impossible circumstances. I came here to do simple work and go home at the end of the day. But you're not simple. No, I'm not. Calloway studied her. What happened in Syria? Her expression didn't change, but something behind her eyes shifted. A door closing. That's classified. I have clearance. Not high enough. He absorbed that, nodded slowly. Fair enough. But I need to know, can you do what you just did again? If another patient comes in like that? If I have to. That's not an answer. It's the only one I have. Before he could respond, Marcus appeared at the end of the hallway, moving fast. Dr. Hale, we need you. She turned. What is it? Another critical patient just came in. Chest trauma. Possible cardiac tamponade. Jenna's tied up in trauma 1 with a ruptured aorta. Bashir's in surgery. You're up. Miriam looked at Calloway. He stepped aside. Go, he said. She went. The trauma bay was controlled chaos. The new patient was a man, late 40s, construction vest still on, covered in concrete dust and blood. His breathing was labored, shallow. The monitor showed muffled heart sounds, jugular vein distension. Beck's triad, Miriam said immediately. He's tamponading. Get me an echo. The ultrasound came in seconds. She ran the probe across his chest. There, fluid in the pericardial sac, compressing the heart. The ventricles were barely filling. I need to drain this, now. Get me a pericardiocentesis kit. A nurse handed it to her. Miriam prepped the site below the xiphoid process. Angled the needle upward, 45 degrees toward the left shoulder. She advanced slowly, feeling for resistance. The needle entered the pericardium. Dark blood flowed back into the syringe. Got it, she said. She withdrew 60 milliliters. The man's pressure immediately improved. His breathing eased. Jesus, the resident beside her whispered. You just did that freehand. No fluoro, no guidance. Don't need it, Miriam said. She withdrew the needle, dressed the site. Get him to CT, rule out other injuries, then to the ICU. She turned to scrub her hands and found Marcus watching her with an expression she couldn't quite read. What? She asked. That needle technique? Subxiphoid approach, steep angle, no imaging. It's standard. No, it's not. He stepped closer, voice low. That's a field technique, combat medicine. I saw it used twice in Iraq, both times by forward surgical teams operating in active fire zones. She dried her hands slowly, didn't answer. Who are you? Marcus asked quietly. Before she could respond, Jenna Ortiz pushed through the trauma bay doors, blood-spattered, exhausted. She saw Miriam and stopped. Did you just do a blind pericardiocentesis? Yes. And it worked? He's stable. Jenna shook her head slowly. I've never seen anyone do that without imaging, not even attendings. I've done it before. Where? Miriam looked at her. At Marcus. At the residents and nurses who had stopped to listen, all of them waiting for an answer she didn't want to give. Navy field hospitals, she said finally. Iraq, Afghanistan, places where you didn't have imaging, or electricity, or time. The room went quiet. How many combat surgeries did you perform? Jenna asked. Miriam hesitated. Then, over 1,200. The number landed like a physical weight. Someone inhaled sharply. Marcus closed his eyes briefly, as if confirming something he'd already suspected. 1,200, Jenna repeated, give or take. And you've been here 5 years doing gallbladders and appendixes. Yes. Why? It was the same question Calloway had asked, the same question she'd been asking herself for 5 years. Because I needed to stop, Miriam said. I needed to work somewhere that wasn't a war zone, where the injuries weren't from IEDs and gunfire, where I could save lives without wondering if the person I was saving would pick up a weapon the next day. Her voice was steady, but something underneath it wasn't. Something old and tired and done. So you hid, Jenna said. Not accusing, just stating fact. I worked. You buried yourself in routine cases to avoid this. Jenna gestured around the trauma bay. Because this is what you were made for. Miriam didn't answer. The overhead system crackled. Dr. Hale to administration. Dr. Hale to administration, stat. She looked up. That wasn't a normal page. Stat to administration meant something official, something serious. Go, Marcus said. We've got this. She left the trauma bay, took the stairs again. Her legs felt heavier now. Exhaustion creeping in at the edges. She'd been awake for 30 hours, performed 6 surgeries, saved how many lives? She'd lost count. Calloway's office door was open. He stood behind his desk, phone in hand, face grave. When he saw her, he gestured her in and closed the door. "What's wrong?" she asked. "I just got a call from the Department of Defense." Her stomach dropped. "Why?" "Because when I pulled your service record this morning, it flagged in their system. Someone noticed." He set the phone down. "They want to know why a former Navy captain with your clearance level is working at a civilian hospital. I retired, honorably. They know that. They know you left under unusual circumstances. They know your last deployment was classified. And they know," he paused, "they know you were never supposed to be practicing civilian medicine without a formal transition review." "That's not true. I went through the full credentialing process. For a general surgeon position, not for a trauma surgeon, not for someone with your specific skill set." He sat down heavily. "Miriam, what happened in Syria?" She was silent for a long time. Then, "I made a call. During a mass casualty event after a bombing in Idlib. We had 14 critical patients and 3 surgeons. I triaged based on survivability and mission value. I saved the ones I could save. That's standard triage. 2 of the ones I didn't save were children." The words hung in the air. "They were too far gone," she continued, voice flat. "Catastrophic injuries. I made the call to focus on the ones we could save. 10 soldiers, 2 contractors. We saved all 12. But those 2 children died while I operated on someone else." Calloway said nothing. The parents were local allies, important allies. The incident became political. "I was removed from command, investigated, cleared of wrongdoing. But the damage was done. So I retired." She met his eyes. "And I came here to do simple surgeries on people who aren't caught in the middle of someone else's war. But you can't escape what you are," Calloway said quietly. "No, I can't." Before either could speak again, the door burst open. Marcus, breathing hard. "We've got a problem. The woman from the bridge, the one you brought back, she's crashing." Miriam was already moving. The ICU monitor screamed before Miriam reached the door. She pushed through, Calloway and Marcus behind her. The young woman from the bridge lay in the bed, chest rising and falling with the ventilator, but the rhythm on the screen was chaos. Ventricular tachycardia, rapid and unstable. The ICU attending stood at the bedside, hands hovering over the crash cart. She was stable 30 minutes ago. Then she just decompensated. Pressure's dropping, heart rate's erratic. "She's bleeding again," Miriam said. She pulled back the blanket, checked the chest tube drainage. Dark blood flowing steady. Too much. The suture line gave way. She needs to go back to the OR. "Dr. Hale, she barely survived the first surgery. Another one. We'll kill her if we don't do it. Get her prepped. Now." The attending hesitated for only a second, then moved. Nurses disconnected monitors, released bed breaks. Miriam kept her hand on the woman's wrist, feeling the pulse. Thready, weakening. They ran. The OR was still occupied from the bridge casualties. Miriam diverted to OR 3, the smallest theater. Usually reserved for minor procedures, it would have to do. "I need anesthesia, a full thoracotomy tray, and 4 units of O-negative," she called out as they wheeled the patient in. The anesthesiologist from the 4 appeared, the same one who doubted her. His face was different now, focused, trusting. "She's barely maintaining pressure. If we put her under." "I know, do it anyway," he nodded. Moved fast. Miriam scrubbed. Her hands were raw from repeated washing. Skin pink and irritated, but steady. Always steady. She'd done this too many times for them to shake now. Through the window, she saw Calloway standing in the observation gallery, arms crossed, watching. She entered the theater. The woman was draped, intubated, chest exposed. The previous incision was still fresh, staples barely 12 hours old. Miriam didn't hesitate. She reopened it. Blood welled up immediately. She suctioned, packed, exposed the heart. There, one of her sutures had torn through the friable ventricular tissue. The heart muscle was bruised, weakened from the prolonged arrest. Difficult to hold sutures. Pledgeted sutures, she said. Fluoroproline with Teflon pledgets. The scrub nurse handed them over. Miriam placed them carefully, using the small Teflon patches to distribute tension and prevent the sutures from tearing through again. 1 stitch, 2, 3. The bleeding slowed, then stopped. But the heart rhythm was still wrong. VTAC, disorganized, inefficient. She needs to be cardioverted, the anesthesiologist said. Not yet. The heart's too irritable. It won't hold the rhythm. Miriam placed her hand on the heart again, felt the erratic beating beneath her palm. Amiodarone, bolus dose. Already maxed out. Then give me magnesium sulfate, 2 grams, slow push. That's off protocol for. Do it. He did it. Miriam kept her hand on the heart, feeling each beat, waiting. The magnesium would stabilize the cell membranes, reduce irritability. It was a technique she'd learned from a cardiologist in Kandahar who'd served in the Israeli Defense Forces. Unconventional, effective. 30 seconds. The rhythm started to organize. 45 seconds. VTAC slowed. 1 minute. Sinus rhythm appeared on the monitor. She's converting, the anesthesiologist whispered. The heart beat steadily under Miriam's hand. Once, twice, regular, strong. She removed her hand slowly. The rhythm held. Close monitoring for arrhythmias, she said. If she goes back into VTAC, cardiovert immediately. But I think she'll hold. She closed the chest again, placed new drains, sutured the skin. When she stepped back, the woman's pressure was rising. Heart rate steady at 82. Stable, the anesthesiologist said. He looked at Miriam with something beyond respect, something closer to awe. You just used a field stabilization technique, magnesium for refractory VTAC without cardioversion first. It works. Where did you learn that? Israel. Through a trauma exchange program, the Navy. V ran in 2011. She stripped her gloves. They've been dealing with blast injuries and cardiac trauma longer than we have. They know things we don't. She walked out before he could ask more. In the scrub room, she stood at the sink, hands under cold water, staring at nothing. 2 surgeries on the same patient in 12 hours. Both times pulling her back from death. How many times could you do that before the universe stopped letting you? The door opened. Calloway entered, closed it behind him. That was extraordinary, he said. That was necessary. Dr. Hale, Miriam, I need you to understand something. He moved closer. What you did today, what you've been doing, it's not just impressive, it's transformative. You saved lives that no one else in this hospital could have saved. Others could have. No, they couldn't. His voice was firm. I watched Jenna Ortiz operate for 3 hours on a ruptured aorta. She's excellent, technically perfect, but she doesn't have what you have, which is the ability to make impossible decisions and live with them. He paused. The board forced you into retirement because we thought you were a liability. We were wrong. Miriam turned off the water, dried her hands. You made your decision based on metrics and policy. That's not wrong. That's institutional medicine. It's also blind. Calloway leaned against the counter. I spent the last hour reviewing your case files from the past 5 years, digging deeper than I did before. Do you know what I found? She waited. 0 complications, 0 post-op infections, 0 readmissions within 30 days. Your outcomes aren't just good, they're statistically improbable. He looked at her. You weren't hiding here, doing routine surgeries because you wanted easy work. You were hiding because you were too good, and you didn't want anyone to notice. I was tired. You were afraid. The words landed hard. True. She'd been afraid. Afraid of being seen. Afraid of being asked to do more. Afraid of making another impossible choice and losing another child she couldn't save. Those children in Syria, Calloway said quietly. You made the right call. Their parents didn't think so. No, they didn't. Because they weren't thinking as surgeons. They were thinking as parents. He straightened. But you were the surgeon. You had to think about the 12 you could save versus the 2 you couldn't. That's not cruelty. That's courage. Miriam's jaw tightened. It doesn't feel like courage. It never does. Silence stretched between them. Outside, the hospital continued its controlled chaos. Patients moved through the system, lives saved and saved again. The endless rhythm of emergency medicine. I'm asking you to stay. Calloway said finally. She looked up. What? I'm going to the board tomorrow. I'm recommending we rescind your mandatory retirement and offer you a new position, Director of Trauma Surgery. Full autonomy over protocols, hiring, and training. Richard, you brought someone back from 14 minutes of cardiac arrest. You performed a blind pericardiocentesis. You used field techniques that aren't even in our textbooks to save a life twice in 12 hours. His voice was steady, certain. This hospital needs you. Not as a general surgeon, as what you actually are. And what's that? The best trauma surgeon most of us will ever see. She stared at him. Part of her wanted to say yes immediately. Wanted to step back into the role she'd been born for, the one she'd spent 5 years running from. But another part, the part that still heard the sound of children crying in a bombed-out hospital in Idlib, hesitated. I need time, she said. You have until tomorrow. The board meets at 9. He moved toward the door, then stopped. For what it's worth, I think you've punished yourself enough. He left. Miriam stood alone in the scrub room, hands braced against the sink, staring at her reflection in the mirror. 68 years old, silver hair, lines around her eyes from squinting through too many surgeries in too many bad conditions. But her hands were steady. They were always steady. Her pager buzzed. She checked it. ICU. The bridge patient. But this time, not an emergency, just a notification. Patient awake. Family requesting to speak with surgeon. She took the elevator up. The ICU was quieter now. The initial wave of bridge casualties stabilized. Lies or transferred. The young woman's room was at the end, door half open. Miriam could see her through the glass, intubated still, but eyes open. A man sat beside the bed, holding her hand. Husband, probably. Miriam knocked softly, entered. The man looked up, red-eyed, exhausted. Are you Dr. Hale? I am. They said you saved her. Twice. I did my job. He stood, walked toward her. For a moment she thought he might hug her. Instead, he just extended his hand. She shook it. Thank you, he said, voice breaking. They told me she was gone. 14 minutes. They said there was no chance. There's always a chance. Not according to everyone else. He looked back at his wife. What made you keep trying? Miriam followed his gaze. The woman's eyes tracked toward her, half-focused but aware. Alive. Because I've seen too many people die, Miriam said quietly. And I refuse to add to that number when I don't have to. The man nodded, wiped his eyes. Will she be okay? She'll need time, rehabilitation. But yes, she'll be okay. He returned to his wife's bedside. Miriam left them there, walked back into the hallway. Marcus was waiting outside, leaning against the wall. Heard Calloway offered you a position, he said. Word travels fast. Always does. Pushed off the wall. You going to take it? I don't know. Why not? Because I'm not sure I can do this again. Make the calls, carry the weight. Marcus studied her. You've been carrying the weight for 5 years, Miriam. You just did it quietly. Maybe it's time to carry it loudly. She almost smiled. That's not very poetic. I'm a nurse, not a poet. He started walking. She followed. You know what I think? What? I think you're afraid that if you step back into this role, you'll have to face what you've been avoiding. Which is? That you're not done. That you never were. They reached the stairwell. Marcus opened the door, held it for her. Get some sleep, Doc, he said. Tomorrow's a big day. She descended the stairs alone, exhausted, uncertain. But for the first time in 5 years, something inside her that had been closed began, slowly, to open. Miriam didn't go home. She found an on-call room on the 4th floor, locked the door, and sat on the narrow bed without turning on the light. Outside, the city hummed with the aftermath of the bridge collapse. News helicopters circled. Emergency lights strobed against the window. Inside this small room, there was only silence. She closed her eyes, not to sleep, just to think. 14 minutes. 2 children in Idlib, 12 soldiers saved, 23 bridge casualties triaged. 1 woman brought back from death twice. The numbers stacked in her mind like a ledger she could never balance. Her pager sat silent on the bedside table. For the first time in 36 hours, no one needed her. She didn't know if that was relief or loneliness. Morning came gray and cold. She showered in the staff locker room, changed into clean scrubs someone had left folded on the bench, and checked her reflection in the mirror. The same face, the same tired eyes, but something underneath felt different, unsettled. Like a bone that had healed wrong, and was now being broken again to set it right. The hospital cafeteria was nearly empty at 7 in the morning. She bought coffee, black, and sat near the window overlooking the ambulance bay. The bridge collapse had been front-page news. Her phone, which she'd turned off yesterday, showed 43 missed calls when she powered it back on. She turned it off again. "Mind if I join you?" She looked up. Dr. Amir Bashir stood with a tray, looking as exhausted as she felt. "Go ahead." He sat. For a moment, neither spoke. Just two surgeons drinking bad coffee and watching the day begin. "I heard about the offer," Bashir said finally. "Everyone's heard. You going to take it?" "I don't know yet." He nodded slowly. "Can I tell you something?" "Go ahead." "I came to this country when I was 19. Medical school in Kabul, then refugee status in 2014, when the Taliban took my district. I spent 3 years retraining, relearning everything in English, proving I was good enough to practice here." He paused. "I thought if I worked hard enough, stayed quiet enough, no one would question whether I belonged." Miriam looked at him. "Did it work?" "For a while. Then I realized I was hiding. Not from them, from myself." He met her eyes. "I was so afraid of being seen as different that I made myself invisible. And invisible doctors don't save lives the way they could." What changed? A patient, Afghan kid, 12 years old, came in with blast injuries from an IED. Everyone else saw a routine trauma case. I saw my cousin, my neighbor. Every kid I couldn't save before I left. His voice was steady, but something underneath wavered. I stopped hiding that day, started pushing for better interpreter services, cultural competency training, outreach to refugee communities, made myself visible. Did it help? It helped the people who needed it. He drank his coffee. "You're hiding too, Miriam. Not from us. From what you're capable of." She didn't argue. Couldn't. "Whatever happened in Syria," Bashir continued, "it doesn't define you. What defines you is what you did yesterday, and the day before, and every day you've been here, quietly doing excellent work because it's who you are. I let children die. You made an impossible choice in an impossible situation. That's not the same thing." "It feels the same." "I know." He stood, picked up his tray. "The board meeting is at 9. Calloway's going to fight for you. But he can't make you stay. Only you can do that." He left her there, alone with her coffee and her thoughts. At 8:30, her pager buzzed. Not an emergency. Just a message. Conference room B. 9 a.m. She finished her coffee, stood, walked. The administrative wing was quiet. The conference room door was closed. She could hear voices inside, muffled but urgent. She checked her watch. 8:57. She waited. At exactly 9, the door opened. Calloway stood there, ties slightly loose, looking like he'd been arguing. "Miriam, come in." She entered. The hospital board sat around the long table. 7 people, all older, looking up at her. All looking at her with expressions ranging from curiosity to skepticism. At the head of the table sat the board chair, a woman named Dr. Patricia Vance, silver-haired and sharp-eyed. "Dr. Hale," Vance said, "please, sit." Miriam sat. Calloway took the seat beside her. "We've been discussing your situation," Vance continued. "Dr. Calloway has presented a compelling case for rescinding your mandatory retirement and offering you a new position. He's also shared some details about your military service that were not previously disclosed to this board." Miriam said nothing. 1,200 combat surgeries, Vance said. "Chief Surgical Officer for Naval Special Operations, multiple commendations. And yet, when you joined our staff 5 years ago, you applied for a standard general surgery position and never mentioned any of this. It wasn't relevant. Wasn't it?" Vance leaned forward. "Dr. Hale, we make decisions based on information. You withheld information that would have significantly altered how we viewed your qualifications and experience. I withheld it because I didn't want to be defined by it." "Why not?" The room was silent. All eyes on her. Miriam felt the weight of the question, the expectation that she would justify herself, explain herself, make them understand. She thought about Idlib, about the 2 children, about the 12 soldiers who lived because she made a choice. "Because I was tired," she said finally. "Tired of being a person everyone turns to when things are impossible. Tired of making decisions that haunt me. Tired of being excellent at something that requires other people to be broken first." Vance's expression softened slightly. And now? I'm still tired. But yesterday reminded me that being tired isn't a good enough reason to stop. One of the board members, an older man named Hendricks, spoke up. Dr. Calloway showed us the outcomes data from yesterday's bridge collapse. 23 critical patients received. 21 survived. That's a 91% survival rate for a mass casualty event. That's extraordinary. It was a team effort, Miriam said. Don't deflect, Vance said, not unkindly. We spoke to the residents, the nurses, the other attendings. They all said the same thing. You were the difference. Your triage decisions. Your surgical speed. Your willingness to take the cases no one else would touch. Miriam net her eyes. I did what I was trained to do. Exactly. Vance glanced at the other board members, then back. Which is why we're prepared to offer you a new position. Director of Trauma Surgery, full authority over protocols, training, and hiring, salary commensurate with the role, and a formal apology from this board for failing to recognize your value. The words hung in the air. Miriam felt Calloway's eyes on her, waiting. There are conditions, Vance continued. We want you to develop a training program. Incorporate the field techniques you used yesterday into our standard curriculum. We want our residents to learn from you. And we want you to consult on our disaster preparedness protocols. That's a significant time commitment, Miriam said. It is, but we believe you're the only one who can do it. Miriam looked down at her hands. Steady, always steady. She thought about the young woman in the ICU, alive because Miriam refused to give up. About Marcus recognizing her suture pattern. About Jenna asking to learn. About Bashir telling her to stop hiding. I have a condition of my own, she said. Vance raised an eyebrow. Which is? I want to establish a program for veteran surgeons transitioning to civilian practice. A mentorship and credentialing pathway. Too many of them leave the military with skills this country desperately needs, and they end up sidelined because they don't fit the traditional mold. Vance glanced at Calloway. He nodded. Approved, Vance said. Anything else? I want Marcus Green promoted to trauma coordinator, and I want Jenna Ortiz as my deputy director once she completes her residency. Done. Vance extended her hand across the table. Do we have an agreement, Dr. Hale? Miriam looked at the hand, looked at Calloway, at the board members watching her with something like respect. She thought about the 2 children in Idlib one last time. Let herself feel the grief, the guilt, the weight. And then, slowly, she let herself put it down. Not forget. Just stop carrying it as the only thing that defined her. She shook Vance's hand. We have an agreement. The board meeting ended at 9:42. Miriam walked out into the hallway where Marcus and Jenna were waiting, trying to look like they hadn't been listening at the door. Well? Jenna asked. I'm staying. Marcus grinned. Jenna exhaled hard, relief plain on her face. Good, Jenna said. Because I have about 600 questions about that pericardiocentesis technique. Later, Miriam said. Right now I need to check on my patients. She walked toward the ICU, the 2 of them falling into step beside her. It felt different now. Not alone, not invisible. Just a surgeon moving through her hospital, doing the work she was meant to do. Behind her, she heard Jenna whisper to Marcus. Think she'll actually teach us? She will, Marcus said. That's who she is. Miriam didn't turn around, but she almost smiled. For the first time in 5 years, the weight on her shoulders felt like something she could carry. Not because it was lighter, but because she wasn't carrying it alone anymore 6 months later. The conference room on the 5th floor had been converted into a teaching lab. Anatomical models lined one wall, a large screen displaying a surgical feed. 20 residents sat in rows, notebooks open, watching intently as Miriam demonstrated a horizontal mattress suture technique with retention pledgets on a practice model. The key is tension distribution, she said, her voice calm and clear. In blast trauma or crush injuries, tissue is friable. Standard sutures tear through. You need the pledget to spread the load across a wider surface area. She completed the stitch, pulled it snug. Perfect tension. The residents leaned forward. This technique saved my patient's life during the bridge collapse, she continued. But I didn't invent it. I learned it from a Navy corpsman in Fallujah, who learned it from an Army surgeon in Vietnam. Knowledge compounds across generations if we're willing to share it. A hand went up. First-year resident, Chen, the same one who'd assisted her on that appendectomy months ago. Dr. Hale, How do you know how much tension is too much? Feel, she said simply. You have to trust your hands. No textbook can teach you the exact pressure. That comes from repetition and attention. She demonstrated again, slower this time. The room was silent except for the sound of sutures sliding through synthetic tissue. When the session ended, the residents filtered out slowly, several stopping to examine the practice models more closely. Jenna remained behind, reviewing notes on her tablet. Good session, Jenna said without looking up. They're learning. Faster than I did. Jenna finally looked up, a slight smile on her face. 6 months ago I thought you were washed up. I'm sorry for that. You thought what the metrics told you to think. Still, I was wrong. Jenna closed her tablet. I have the Veteran Transition Program applications. 12 candidates so far, all former military surgeons. Do you want to review them? Send them to my office. I'll go through them tonight. Jenna nodded, started to leave, then paused. Miriam, can I ask you something? Go ahead. Do you ever regret it? Staying? Miriam considered the question. Some days are harder than others. But no, I don't regret it. Good. Jenna left. Miriam packed up the teaching materials, switched off the lights, and walked toward the ICU. Her rounds had expanded significantly. As director of trauma surgery, she oversaw 42 beds, supervised 8 residents, and consulted on every major trauma case. The work was relentless and necessary. The bridge collapse patient, whose name she'd learned was Sarah Dennison, had been discharged 4 months ago. But she'd sent a card last week. It sat on Miriam's desk now, a photo of Sarah and her husband on their front porch, smiling. The note inside read, "Thank you for not giving up. We're expecting a baby in March." Miriam had read it 3 times, then filed it carefully in her desk drawer, alongside 2 others from patients she'd saved over the past months. In the ICU, she found Marcus reviewing charts with a new trauma coordinator, a former Air Force medic named Lori Chen. They looked up as she approached. Evening rounds? Marcus asked. Just checking on the MVA from this morning. Bay 6, stable. Jenna did the damage control lap. Clean work. Miriam nodded. She moved to Bay 6, reviewed the chart, checked the patient's vitals. Everything within acceptable ranges. She made a note, signed off, and returned to the central desk. Dr. Hale? She turned. Lori Chen stood holding a tablet, expression uncertain. Yes, I wanted to thank you for the transition program. I've been out of the military for 3 years, working as a paramedic because I couldn't get credentialed as a surgical PA. This program gave me a path back. You earned it, Miriam said. Your application was excellent. Still, thank you. Lori hesitated. Can I ask you something? Miriam waited. How do you turn it off? The war. I still hear it sometimes. Helicopters, explosions. I know I'm here, but part of me is still there. Miriam looked at her, saw herself 5 years ago, 10 years ago, 20. You don't turn it off, she said quietly. You learn to carry it differently. Find purpose in the present instead of running from the past. Lori nodded slowly. Does it get easier? Some days, others, no. But you learn to recognize the difference between remembering and reliving. Thank you. Lori returned to her work. Marcus watched the exchange, then looked at Miriam. You're good at this, he said. At what? Mentoring, leading, being visible. She almost smiled. I'm learning. Her pager buzzed. She checked it. Dr. Bashir, requesting a consult. She headed toward the ER. The emergency department had been renovated in the past 3 months. Expanded trauma bays, updated imaging equipment, a dedicated resuscitation unit. Changes Miriam had pushed for after the bridge collapse revealed critical gaps in their mass casualty response. Bashir met her near trauma 2. Got a tricky one. 57-year-old male, former Marine. Came in with what he said was indigestion. EKG shows STEMI, but he's refusing intervention. Why? Says he doesn't trust civilian doctors, only wants someone who's been there. Miriam understood immediately. She entered the trauma bay. The man sat upright on the gurney, jaw tight, face pale and sweating. Classic presentation for a heart attack, but his body language screamed distrust and fear. Sir, I'm Dr. Hale. I understand you're refusing treatment. Damn right I am. No offense, but I don't know you people. That's fair. Can I tell you something about myself? He eyed her warily. Go ahead. I'm a Navy veteran, 22 years, served in Iraq, Afghanistan, Syria. I was chief surgical officer on the USNS Mercy and lead trauma surgeon for JSOC. His expression shifted. Your military? Now I'm here." He studied her face, looking for something. Whatever it was, he found it. "What do you think is wrong with me?" he asked. "You're having a heart attack. If we don't intervene in the next 20 minutes, you'll have permanent heart damage. Maybe die." "You being straight with me?" "Always." He looked down at his hands. "I've been out for 8 years. I still don't know how to be a civilian, how to trust people who weren't there." "I understand that, but I'm asking you to trust me now. Not because we served, because I know what I'm doing, and I'm not going to let you die in my ER if I can help it." He met her eyes, nodded once. "Okay." She turned to Bashir. "Get him to the cath lab, call cardiology." 30 minutes later, the patient was stable, stent placed, blood flow restored. Miriam stood outside the cath lab, watching through the window as the cardiologist finished up. The man would live. Another one pulled back from the edge. Her phone buzzed. A text from an unknown number. "Dr. Hale, this is Patricia Vance. The board has approved your proposal for the National Veteran Surgeon Integration Program. The VA wants to partner with us. Call me tomorrow to discuss." She read it twice, then put the phone away. That night, she stayed late in her office, reviewing the 12 applications for the Veteran Transition Program. 3 Navy, 4 Army, 2 Air Force, 1 Marine, 2 Coast Guard. All of them carrying skills and trauma and the weight of service. She made notes on each file. Questions to ask, skills to assess, ways to integrate them without making them feel like they had to hide who they were. At midnight, she finally left the office. The hospital was quieter now, night shift in full rhythm. She walked through the surgical wing, past the ORs where she'd spent so many hours, and stopped at the observation window overlooking Trauma 1. A surgery was underway. Jenna at the table, Chen assisting. Smooth, efficient, confident. Marcus appeared beside her, 2 cups of coffee in hand. He offered her one. "Can't sleep?" he asked. "Too much to think about." "Good problems or bad problems?" "Good ones, I think." They stood in silence, watching the surgery through the glass. "You know what I realized?" Marcus said after a while. "What?" 6 months ago, you were invisible. Now, you're the person everyone looks to. Not because you demand it, because you earned it. "I'm just doing my job." "No, you're doing what you were always meant to do." He sipped his coffee. "And you're teaching the rest of us how to do it better." She didn't respond, didn't need to. Below, Jenna completed the procedure, clean, fast. The patient's vitals remained stable. Good work. Miriam finished her coffee, said goodnight to Marcus, and headed for the parking garage. Her car sat alone under the fluorescent lights. She unlocked it, sat behind the wheel, but didn't start the engine. She thought about Sarah Dennison and her husband expecting a baby. About the Marine who'd trusted her enough to accept treatment. About Chen and the other residents who were learning techniques that would save lives for decades to come. About Lori and the 11 other veterans who would soon have a path back to the work they loved. She thought about the 2 children in Idlib. They would always be there, part of her history, part of her weight. But they weren't the only story anymore. She started the car and drove home through the empty streets. Tomorrow, there would be more patients, more surgeries, more impossible decisions and improbable saves. The work would never end. But for the first time in 5 years, she wasn't running from it. She was ready. Her phone buzzed one last time as she pulled into her driveway. A text from Jenna. "Trauma alert just came in. ETA 15 minutes. Multiple GSWs. We could use you if you're available." Miriam looked at the message, looked at her front door, looked at the clock on her dashboard. She put the car in reverse and drove back to the hospital. Because this was who she was, not in spite of her past, but because of it. Dr. Miriam Hale, 68 years old, Navy veteran, trauma surgeon, still steady, still fighting, still refusing to give up when everyone else called it. The hospital lights appeared ahead, bright against the night sky. She was home.